Thank you all so much for joining us, and happy Friday. Uh, Today, you'll be joining our class on with Community Legal Aid SoCal about spousal impoverishment. But before we get into our material, we wanted to give you a brief overview of the services we provide as the Caregiver Resource Center. A bit of housekeeping for this class. So this class will be recorded. Please be mindful while sharing information or personal details. Please feel free to turn your camera off and/or change your name if preferred. Please ask questions throughout the presentation by raising your hand, unmuting, or typing in the chat. So a bit about the history of the CRC. We've been serving Orange County since 1988. We are a nonprofit program of St. Jude Medical Center, and we are part of a system of caregiver resource centers. So there are 11 total in the state of California, and one for each county. So we serve all of Orange County, there's one for LA County, etc. And we're funded through the Older Americans Act, and by the county through the Family Caregiver Support Program. So who are we? We are a trusted partner for Orange County families coping with the physical, emotional, and financial responsibilities of caregiving. Our mission is to increase the quality of life of caregivers by helping families and communities master the challenges of caregiving. Our goal is to make sure that caregivers don't feel alone in their caregiving journey and they feel supported to take care of both themselves and their loved ones. To be eligible for our registered resources, you do have to be an Orange County resident, and you have to be a caregiver who is an adult who is caring for a person under the age of 60 with an adult onset cognitive brain impairment or traumatic brain injury, or you're an adult who's caring for a person 60 years or older with a chronic illness that needs significant help with their activities of daily living. So these are our services. The services that are in orange are the ones that are open to everybody and anyone. So anyone can join our support groups. We offer them virtually and in person, and in 3 languages, English, Spanish, and Vietnamese. Anyone who calls our center has access to specialized information. They can call us for a list of in-home care agencies, nonprofits, etc. Anyone who we also offer classes like the one you're attending right now, and legal workshops. For our registered clients, they do have to meet those eligibility requirements that I mentioned earlier, and they have access to our individual counseling. They'll also have access to our family consultants who act as like their point person for any goals they have in caring for the loved one, such as pursuing a new insurance or a certain resource in Orange County. And our most popular resource is our respite assistance. So we have grant funds that can pay for in-home care, out-of-home care, grant funds that can pay for supplies they might need, like grab bars, wheelchairs, etc. And we have a grant that can pay for cleaning services to help out with like chores around the house. This is a handout we like to pass out to all the caregivers to remind them to take a break, and to remind them like that self-care is important. And a lot of times when caregivers do get free time, they don't know like what to do with that free time. So these are some ideas how you could spend it. Not all the options are safe. I see one that says climb a tree. So just, yeah, you can look at this and feel free to pick one that works for you. And this is our contact information. So again, if you want more classes like the one we're about to get into, please feel free to reach us at our number or on our website. And with that, we'll get into our class material for today. And I'll pass it to Joan.
Hello, everyone. Happy Friday. I know it's Friday afternoon, My brain is usually fried at this point, but I hope I'm able to present as best as I can to y'all. I want to start off by taking a deep breath. Maybe we can all take a deep breath as a group together. And then I'll do a little like break in the middle of the presentation. We're gonna go through a lot of slides. It's kind of a lot of info, but just know that y'all will have access to the slides and the recording at a later time to reference. So you're not gonna be, responsible for memorizing everything. It'll always be there for your reference later and after the presentation. But let's kind of just start off as a deep breath because it's Friday, it's an afternoon. I know there's a lot of things going on in our households, in the world, and it's just kind of nice to be able to take a deep breath. Maybe we can do 2 deep breaths together as a group. I'll start us off. Let's take a deep breath in through our nose, out through our mouth. One more, deep through our nose, out our mouth. Let all that out. Okay. I know this is the Caregiver Resource Center, and I like to use the airplane oxygen mask metaphor. If you don't take care of yourself, you can't take care of your loved ones. So make sure you take the time and the energy to, care for yourself so that you can do right by your loved ones and family and friends. Okay. All right, let's dive in. I forgot to introduce myself in all of that breathing. My name is Joan Chang. I use she, her pronouns. I work at Community Legal Aid SoCal. I'm a staff attorney specifically in our health unit. So let's dive right in. We're going to talk about Medi-Cal, spousal impoverishment. I'll do a brief kind of intro to who we are as an org, and then dive into our topic here. Okay. Okay, can y'all see this? Can I get a verbal? Yes, I can see this slide that says Medi-Cal.
Yes.
Yes, thank you. And I'm a fan of let's use the pen. Can you guys see this red pen that I just underlined? Can I get a verbal yes?
Yes.
Thank you. Okay, because everyone at this point is now like a small square on the right side of my screen. So a verbal yes is helpful. Thank you. Okay. All right, we're going to be talking about Medi-Cal, expanded spousal impoverishment for home and community-based services. I know that's a mouthful. That's why in the health world, we like to use a lot of acronyms, but we'll go through each of these acronyms and what they mean. And you're going to be sick of the phrase spousal impoverishment after the end of this presentation. Hopefully, that'll be my goal, to get you guys sick of spousal impoverishment. Okay. I'm going to kind of go through our introduction to our organization pretty quickly because we have a lot of ground to cover in this presentation. But this is our mission statement. We're Community Legal Aid SoCal. We're a nonprofit law office. We do not charge for our services, so keep that in mind. We do have physical offices in Compton and Norwalk in a Southeast LA County, and in Orange County, we have Anaheim and Santa Ana. Santa Ana is where I am at. Okay, we do have other units. I'm just gonna highlight them here, but to let y'all know that I'm in the health unit here. So that's why we're talking about Medi-Cal and health. So we'll dive into Medi-Cal, or we'll dive into the health unit services. I'm gonna skip this one. Suffice it to say, we help in most insurance type of coverages. So typically, a lot of our clients are low income. So, we're assisting with Medi-Cal, but we do assist with those with Medicare and those who are what we call duals. We also do assist with Covered California, dental. Sometimes people forget that dental is considered medical. So dental and dental billing as well. We also do assist with IHSS, in-home supportive services. And if you have private insurance, we can also provide some guidance there. I'm going to skip this because I know we have so much to cover, but just to know, these are kind of our buckets of areas of assistance. Eligibility, meaning, if you're applying for a program like Medi-Cal, Medicare, or Covered California, and making sure you stay on. Benefits is once you have insurance coverage, accessing care and making sure there's not delays or denials. Hearings, if needed, our office can represent you in a Medi-Cal hearing, an IHSS hearing, or even a Medicare hearing. Medical billing, we do assist with, sometimes I have clients sending me a bill saying, hey, is this right? I got this bill from the hospital, I got this bill from the doctor. Am I supposed to pay this? Did insurance pay as much as they were supposed to? So sometimes our job is to just review your medical bills to make sure you're getting properly or improperly billed. So, but that also includes dental and dental credit cards. There is such a thing as dental credit cards. There are dentist offices that can sign you up for credit cards in their office, but there's a lot of laws and protections in that area. So we could provide assistance with dental credit card billing. I'm going to skip this, but we are the Ombuds service provider for dual eligible. So if you have both Medi-Cal or Medicare or eligible for both, you can go ahead and give us a call. We are the DMHC CAP program service provider and a proud member of the Health Consumer Alliance. This is a statewide collaborative of other legal aids up and down the state. And we meet regularly and we have regular forums with DHCS, the Medi-Cal, the state agency in charge of Medi-Cal. We regularly meet with Covered California, DMHC. So we have these meetings with state agencies that can hopefully help California and statewide. Okay, I'm going to just kind of skip through some of these things because we're going to have a lot to cover today. Okay. What the heck is spousal impoverishment? You may have heard the word or you may have not heard this phrase before, but hopefully by the end of this, if you just remember spousal impoverishment somewhere in your brain, then I've done my job. The information that I'm going to be throwing at you, it's a lot, but you're not supposed to memorize all this stuff. Just know that spousal impoverishment is a thing, okay? That's the goal. Okay, what the heck is spousal impoverishment? Let's talk about it. The policy, the legal policy behind it is we don't want to leave what we call so this is kind of assuming a scenario where there's a sick spouse and a healthy spouse within a household. The idea is we don't want to leave our quote healthy spouse impoverished financially. So essentially it's rules and legal rules that allow for a quote healthy spouse to be able to keep more income and assets and still be able to hopefully get the sick spouse, the quote sick spouse Medi-Cal and access to Medi-Cal. Spousal impoverishment is a counting method. So they count income and assets differently from regular Medi-Cal. It is not a separate Medi-Cal program. It's not a separate Medi-Cal aid code. It's just a different way in calculating income and assets for a married couple. Okay, the benefits are it allows for couples, married couples, and I want to say married or those who are in a registered domestic partnership. We're going to go into more detail about that in a minute. So, but it allows couples to have more income and more assets to qualify for either free Medi-Cal, what we call full scope Medi-Cal, or might lower their share of cost. So if you have a Medi-Cal with a share of cost, spousal impoverishment may be able to potentially lower that or even get rid of the share of cost altogether and get you free Medi-Cal. And with that, it allows for married couples and registered domestic partners to access needed services. So that includes nursing home care. So that's spousal impoverishment. That also includes home and community-based services. That's expanded spousal impoverishment. We're going to talk about the difference. And then just in general, just accessing Medi-Cal benefits. There's so much in the world of Medi-Cal now, and we want to make sure everyone who can get access to Medi-Cal and nursing home care and home and community-based services. Okay, so we're gonna, again, there's more acronyms here, but stick with me here. So there's a difference between SI and ESI. So there's spousal impoverishment and then expanded spousal impoverishment. I like to call spousal impoverishment as like the original spousal impoverishment, and expanded is like kind of the 2.0. Spousal impoverishment, essentially it's for those who have what they call Medi-Cal. I don't like to use this phrase, but Medi-Cal still uses it, an institutionalized spouse. Essentially what that means is that there's a spouse in a nursing home. So in this situation where you have a spouse in a nursing home and then a spouse who's still living at home. The spouse that's living at home is considered the home spouse, aka the community spouse. This spouse that's in the nursing home is considered the quote institutionalized spouse. Okay. But then the laws got expanded where we can apply these same rules to those who are still living in home or community. So essentially, this would be this gentleman right here, still being able to receive these same benefits of spousal impoverishment, but still be able to remain in the home or in among the community. So essentially, ESI, expanded spousal impoverishment, it allows couples access to home and community-based services. And the whole point in policy is to perhaps avoid a nursing home and avoid institutionalization. I should put this in quotes. Okay, so I hope these pictures kind of, this is SI, this is ESI. SI, again, is a situation where you have a spouse in a nursing home. ESI is a situation where the spouse is either still living at home or in the community, which would be like an assisted living or board-in care. That's still technically considered community. Okay. I'm going to skip this. This is more for citations, but here are all the Medi-Cal letters and things that are about spousal impoverishment and expanded spousal impoverishment. These are more for advocates and attorneys and Medi-Cal nerds like myself. Okay, let's go through what the ESI requirements are. So let's talk about what the spousal impoverishment requirements are. There are 3 requirements. Again, I'm not going to test you on this after the presentation. You're not expected to know all these things. If just the phrase spousal impoverishment is something that you remember after the end of this presentation, then I've done my job. These slides and this recording will be available to you afterwards. So don't feel like you have to take all these notes down and memorize all this stuff. But all right, but I still want to go through the requirements. The 3 requirements for spousal impoverishment are you have to either be married or in a registered domestic partnership. And that's why I did the R, because it's quite a long phrase. A registered domestic partnership. Okay, so it's called spousal impoverishment. So you have to be married or in a registered domestic partnership. You also need the quote sick spouse to need nursing facility level of care. We call that NFLOC. Again, more acronyms for you. The spouse needs to have a doctor to sign off to say, hey, this person, if they don't receive home and community-based services, they may be at threat of being placed in a nursing home. So this has to be medically determined by a physician or by a waiver evaluation. And then number 3 is you have to put in a quote request for home and community-based service. I should put here, it's just a waiver program. It has to be one of the waivers, and we'll talk about what that means. Okay, so we're going to go through each of these requirements one at a time. Again, number 1, married or registered domestic partnership. 2, you need nursing facility level of care for the sick spouse. And 3, you need to quote put in a request for home and community-based services. Okay, we're going to dive into each of these requirements. But maybe I should stop. Any questions at this time? Because we're going to go into more detail about each of these requirements. But before I dive in, any questions, comments, concerns? I don't mind awkward silences if it means people ask their questions.
I have a question.
Yes, go ahead.
So I'm with Adult Protective Services.
Oh, okay.
I've
Welcome.
had a
Hi.
couple, hi. I've had, thank you for having this, because I did do Medi-Cal way back in the day.
Okay.
And I'm a little frustrated because why is it that since this is a Medi-Cal program, Medi-Cal workers don't seem to know what I'm talking about
Yeah.
if this is a Medi-Cal program?
Technically, it's not a Medi-Cal program. It's just like a income and asset calculating method. But you're right. A lot of county eligibility workers are not familiar with spousal impoverishment. The way that it works in the county is, and we've worked pretty hard to kind of educate and make sure that they're streamlining these spousal impoverishment cases. There is kind of like a referral process within the county where if someone does identify a case as, quote, spousal impoverishment, they send it over to like a specialized unit within the county eligibility, Medi-Cal eligibility division, and they send it to kind of the spousal impoverishment experts, the caseworkers who know about it.
I haven't found anybody that could do it.
I know. Yeah, and that issue is still happening.
Okay.
If that's the case, insist on, this is what I tell my clients, insist on speaking to someone. Sometimes we have to be our own Karen, or, I forgot what the male version of it is. But, speaking to a supervisor and making sure you get to somebody who knows what the heck spousal impoverishment is. But, I'm going to include our contact information at the end. If if there's a situation where you have a client who is eligible for spousal impoverishment and the county is not properly responding, you can go ahead and send those cases over to us, and we could sort it out and make sure it does get properly screened and evaluated.
Okay, thank you.
Okay, but yes, I do have to say, these rules that you all are going to be learning during this presentation, there's a lot of county eligibility workers who are not familiar with it. It's a lot, it's complicated, it's complex. So like I said, there's only a handful of caseworkers who really know about these rules. But the idea is, even if you mention spousal impoverishment, they're supposed to refer it over to those experts within the county. If that's not happening, speak to a supervisor to make sure it is. If not, come to us and give us a call, and we can hopefully help y'all escalate it up. Okay. All right, let's move on to these individual requirements here. So let's talk about requirement number 1. You have to be married or in a registered domestic partnership. All right, number 1. So the rule is you don't have to verify. So you don't have to necessarily submit like your marriage certificate. Self-attestation is enough. So if you're just reporting that, yes, I am married to this person, or I am in a registered domestic partnership with this person, then it should suffice with the county. Honestly, I don't think with all of my spousal impoverishment cases, I don't think I've ever had an issue with this requirement with the county before. So self-attestation is enough. You don't need to, submit marriage certificates or your registered domestic partnership papers. Okay, let's talk about requirement number 2. You need to have the, quote, sick spouse need nursing facility level of care. You can do that in one of 3 ways. Okay, number 1, you can have a needs assessment by IHSS. So there's 4 programs within IHSS. Here's IHSS. Sorry for my chicken scratch here, but there's like 4 programs. I don't know all of them by heart, but there's one called CFCO. This is the only one that's eligible for spousal impoverishment, expanded spousal impoverishment. These others, nope, you can't have spousal impoverishment apply. So you have to make sure you're getting evaluated for CFCO, that stands for Community First Choice Option. And so if you mention that phrase CFCO or this phrase Community First Choice Option to IHSS, they'll know what that is. Make sure you're requesting for CFCO, because that's the only one where you can have spousal impoverishment rules apply. But if you've done, your home visit with IHSS, with your IHSS social worker, and, on the back of your notice of action, it says, yes, you are successfully enrolled into the CFCO program, then that's all you need. You've already proven that you meet this requirement of nursing facility level of care. Another way that you can prove nursing facility level of care, if you've had a needs assessment by one of the waiver programs, and we're going to talk about each of these waiver programs in a couple of slides down. But as long as the waiver program's already said and given you that stamp, hey, you meet the nursing facility level of care, you're good to go. The most common one, however, when you're first applying for Medi-Cal is this form. This is an MC 604 MDV form. This is a hyperlink form, a hyperlink that'll be included in the slides after the presentation. The next slide, we'll talk about what this form is. Okay, so you just need one of these three in order to prove requirement number 2. Okay. So this is what the form looks like. It's a simple 2-page form, but the most important part is here. This is a simple form that your doctor will fill out, and it has to be an MD and a physician. But it's basically, the doctor prints their name, their date, their telephone, their address. They're going to write, the patient's name here, and then the date of which they needed the services. So here it says here, and let me read it out loud. Based on my examination, my patient, Jane Doe, John Doe, will likely require nursing facility level of care for at least 30 consecutive days, unless she receives in-home care and support and services that will permit her to reside safely at home. And then it gives like an onset date. To be honest with you, for the most part, most of my clients have had, supportive doctors who were able to fill out this form, but it's pretty, if there's ever an issue, where doctors are just like a little hesitant in filling out the form, please give us a call and we could kind of explain, the importance of why this form needs to be filled out. But it's pretty simple. You just write the name, the doctor just has to write the name of their patient and sign off saying blah, blah, blah. This person needs nursing facility level of care. And then they write in an onset date. So it's pretty easy. Typically, what's supposed to happen is this form is supposed to get sent out by the county to you so that you can give it to your doctor. I've only seen that happen once in the many spousal impoverishment cases I've handled. So typically this form is available on the website. So typically what I do is just send the form over to my clients and have them just have their doctor fill it out. And the county can go ahead and contact the doctor to verify that, hey, is this you? Did you sign this? Did you date this? Did you fill this out? So keep that in mind. You can go ahead and pull the form from the website and print it out on the public website yourself, and then send it to the county office. Okay, so this is requirement 2. Okay, the rule technically is, like I said, the county is required to mail out this form to you as soon as you put in a request for IHSS or home and community-based services. But like I said, I've only seen that happen once throughout my time of handling these spousal impoverishment cases. So I would go ahead and proactively just print out the form from the website and just give it to your doctor. Okay, but let's move on to requirement number 3. You have to put in a request for home and community-based services. So again, requirement number 3, you have to put in a request for HCBS, aka home community-based service. This is actually a slide from DHCS, the state agency in charge of Medi-Cal. So these are different ways that you could, quote, put in a request. You can put in a request with the waiver agency. So sometimes people start at Medi-Cal, some people start at the waiver agency. There's no wrong door. So if you started at the waiver agency, then they will go ahead and, put a referral in for you to go to Medi-Cal and fill out a Medi-Cal application. You could also start with Medi-Cal and do the application, and then go from there too. You could also, be putting a request for IHSS. So all of these are considered, quote, requests that will satisfy this requirement number 3. On Medi-Cal's application, there is a question, and I'll show it to you in the next slide, where it asks about home and community-based services and long-term care. As long as you check yes on that question, you satisfy this requirement. Or even if you just go to the county and verbally ask, hey, are there these, services that I can get that can help me out in the home? Because I'm having trouble kind of with my day-to-day. Even just verbally asking at the county for services like this will satisfy requirement number 3. So let's look at these examples here. There's different request examples. Let me physically show you. Okay, this is on the Medi-Cal application form. So if y'all have ever applied for Medi-Cal, you've probably filled this form out either online or on a paper form. But this is what the question that we want to make sure we check yes to looks like. It says, do you need help with long-term care or home and community-based services? As long as you say yes, you're meeting requirement number 3. So this is, make sure you always answer yes to these questions on any of these forms. So, but this is the form for the actual Medi-Cal application when you're first applying for Medi-Cal. You can also do this at your renewal form. So as y'all know, if you have Medi-Cal, you have to renew your Medi-Cal every 12 months. I think one of the last few pages of the Medi-Cal form, when you kind of flip through it, is this page. And it says this is an optional, but fill it out because then it might trigger you meeting requirement number 3. The question first is, do you want information on in-home supportive services, aka IHSS? You want to be able to check yes to that question. Also, this is the same question as the one on the prior slide. Does anyone in your household need help with long-term care or home and community-based services? You're going to want to make sure you check yes on that question too, because once you do, you meet the requirement for number 3. Okay. Well, I think I'm gonna skip. Okay, all right. Let's do this. Initially, when you apply for, you only need to show that you've applied for the home and community-based service program. So as long as you've applied for it, the county has to apply these special rules. They have to apply these special income and asset calculating rules. So once you even just applied, that's enough for the county to trigger the ESI rules. If you are waitlisted or even enrolled in the home and community-based service program, then the ESI, spousal impoverishment still applies. So even if you're quote waitlisted, you still have to have the county apply spousal impoverishment to your case. However, if your home and community-based application is denied, then that allows the county to stop applying spousal impoverishment to your case. So if you've gotten like an official denial from the home and community-based service program, then again, it allows for the county to say, hey, we don't need to apply spousal impoverishment anymore to your case. And then change in circumstances, things like if you no longer receive the home and community-based service, that also allows the county to stop applying spousal impoverishment to your case. So in these 2 scenarios, that's when they can say, all right, we're gonna just not allow for spousal impoverishment anymore. Okay, I'm an attorney, so I'm putting the fine print and kind of the legal citations to what we've just talked about here. Okay. Why the heck do I need to know about spousal impoverishment? Why are we here today? Why are you throwing all this information at us, Joan? Let's talk about why. The beauty and the benefit of spousal impoverishment, it allows for couples to have more money in income and assets to potentially still qualify for Medi-Cal with either a lower share of cost or even free Medi-Cal without a share of cost. So the way that it works is, so I do want to kind of, I don't know if I might be a bearer of bad news or if y'all have heard through the grapevine, the asset test for Medi-Cal is coming back. Starting January 1 of 2026, Medi-Cal will now once again, start counting and looking at your assets. So back in 2024, we got rid of it, but unfortunately, the asset test is coming back due to state budget concerns. So we're gonna have to worry about, the Medi-Cal office is gonna ask you for your bank statements, how much is in your bank accounts. They're gonna start asking for, the vehicle registrations of your second vehicle, all the stuff that we used to have to do before 2024, we're gonna have to start doing again. We're gonna have to start producing our asset verification documents. But that's not gonna start until next year, so just keep that in mind. So, but the beauty of spousal impoverishment, it allows for couples to have and keep more assets and still remain eligible for Medi-Cal. So for regular Medi-Cal, non-spousal impoverishment Medi-Cal, the asset limit is going to be $195K. But with spousal impoverishment, you could potentially have a total of this amount in assets and still remain eligible for Medi-Cal. So just keep that in mind. Spousal impoverishment, the beauty of it is you're potentially able to hold on to more assets and still remain eligible for Medi-Cal. And then same for income, you would potentially be able to hold on to more income and still remain eligible for Medi-Cal with spousal impoverishment. So the next slide, I hope, is more visually, it'll help you kind of understand visually what we're talking about here. Okay. On this side of the chart, this is for regular non-Magi Medi-Cal rules. So we're not talking about spousal impoverishment. These are non-spousal impoverishment cases. The way that it works is when Medi-Cal is looking at your household and your income and your assets, they're looking at both spouses together. So we're talking about the sick spouse and the healthy spouse, and they are considered in the same household together. So your spouse's income, your spouse's assets are being counted against you. Your assets and your income are going to be counted against your spouse. That's how the regular Medi-Cal rules work. Under spousal impoverishment, the beauty of it is they separate it out. So it's kind of like your income is your income, your assets are your assets, my income's my income, my assets are my assets. And also the beauty of spousal impoverishment is it allows for an allocation. You can allocate your income to a point and allocate your assets to a point to your spouse so that you could potentially remain eligible for Medi-Cal. So let's kind of look at this on a side-by-side comparison on asset or on income levels. So under regular rules for Medi-Cal, this is as much income as you can have for free Medi-Cal. Free Medi-Cal, I should write that down. Sorry for my chicken scratch. I'm doing this with my mouse here. Versus with under spousal impoverishment, a couple could potentially have up to this amount and still potentially remain eligible for free Medi-Cal. So it's much higher, 2,433 versus 5,749. That's a huge difference. So, for our folks who are in between these two amounts, this is when spousal impoverishment may come in handy for you and your household. Same with the assets. With assets, with regular Medi-Cal, we're looking at an asset limit of 195K versus potentially up to 287K in spousal impoverishment. So if you are in between these two, spousal impoverishment would definitely be something you want to apply for because you would benefit and potentially still get access to Medi-Cal despite being over asset for regular Medi-Cal. Again, keep in mind the asset test, currently there is none, but starting January 1 of next year, the asset test is returning. Okay, I know I threw a lot of info at y'all. I hope this slide is super helpful for you visually, but are there any questions, comments, or concerns?
Jones, there's a question on the chat.
Oh, can someone monitor the chat for me? I can't.
I'm monitoring it. But
Oh, okay.
there's a
Thanks,
question
Sarah.
that says income includes 401k, SSN, etc. active working per day. Do you want to answer that, Joan, or?
So 401k, so 401k distributions are considered as income, potentially not as assets. It's kind of a funky situation. If you are getting what we call periodic periodic scheduled distributions from your 401k or from your IRA or from some sort of retirement account, then the balance that you have in your account, your retirement account, will not be counted as an asset. However, if you are not receiving scheduled periodic distributions from those retirement accounts, it is considered an asset that's going to count against you for against this limit, this limit or this limit. It's a funky technical question. If you have more detailed questions about 401k income and 401k as an asset, give us a call and we'd be able to kind of provide you more case-by-case individualized advice.
Thank you.
Yes. Sorry, Sarah, was there something else I didn't get answered?
She said someone asked what constitutes an asset, and I think Joan just explained it's the same as before the asset elimination took place. So there is nothing has changed from prior when we had the asset
Yeah, there's going to
limit.
be
So
some assets that are just not counted. You know, your one vehicle is considered quote exempt. Your residence, your primary residence is considered quote exempt. So they don't count towards this limit or this limit. All those rules that we used to have to remember back in pre-2024, all those rules most likely will still remain. So yeah, but if there are particular assets that y'all are concerned about, give us a call and we'd be able to kind of provide whether it's exempt or not exempt. And it sometimes just depends on the asset type. Okay. Any other comments, concerns, questions?
I'll answer some of them in the chat, Joan.
Thanks. But Sarah, if you want, if you could just field them for me and then I'll answer them for the group too.
Okay, well, this one, will the asset test be implemented in January or renewal? You want to answer that?
Yes, so I didn't include, maybe I did or didn't. It will be at your renewal. So if you already currently have Medi-Cal, you're not going to be required to produce any sort of like asset verification, like, you know, your bank statements, things like that. You're not going to have to produce that until your renewal month. So if, for example, you typically renew your Medi-Cal in November, you're not going to have to produce your bank statement until November of next year, November of 2026. The county cannot ask you to verify your assets until your renewal month. So no earlier than that. If you are applying for Medi-Cal after January 1 of 2026, you will be required to produce asset verification docs like your bank statements. But if you are an existing Medi-Cal beneficiary, you won't have to produce all that paperwork until your renewal month.
And then the last question is, I think, should all bank account be in the well spouse name?
Again, that's
Case by
case by case, because it may very well be under this amount. This amount is the amount that a quote sick spouse can have and still remain eligible for Medi-Cal. So it really is a case by case situation.
And there's calculations involved, so yes.
Yes, we do a lot of math at Legal Aid. Me and Sarah were attorneys, but we do a lot of math every day. These are really great questions. I want to make sure I'm answering them at this time. Any more in the chat or any more, you could raise your hand or just take yourself off mute. Okay, well, if you come up with any more questions along the way, feel free to interrupt me and ask. And Sarah, if you can monitor the chat,
I'll
or
monitor.
someone at, yes, a CRC can monitor, that'd be great. Okay, higher income limits. Okay, I'm gonna just skip all this just to be able to highlight this. The beauty of spousal impoverishment is you could, oh, hello, yes? Okay. The beauty of spousal impoverishment, it also allows you to allocate money from the sick spouse over to the healthy spouse. Remember this thing right here? You can give some of your money or your assets from the sick spouse to the quote healthy spouse. So keep that in mind. You can allocate some of that money, but there is a cap. There is a cap for 2025. The cap is no more than $3,948 per month. However, I do want to say this because I'm an attorney. There is an ability to allow for an allocation that's going to be greater than this amount. But you do have to do a state hearing order or a quote order of support to increase that amount. So our office, unfortunately, does not assist with these types of orders. We would most likely refer you over to a private estate planning attorney. Canner has a lawyer referral service with private attorneys who handle these types of orders. But just keep that in mind. Just because you might need to allocate more than this amount doesn't mean that that's kind of the end all be all. There's potential for being able to get something above this amount. Okay, income calculations. Step one, you're going to split the household, right? So if we're talking about a household that has a husband and a wife, you splitting them. You're no longer part of the same household. You're now in separate households. And then if needed, step two is, say for example, in our situation, the husband is the sick spouse. I'll just write 6 here. There's an ability for the sick spouse to allocate some funds over to the well spouse or the healthy spouse. And then at that point, then you use the regular Medi-Cal rules on assessing eligibility. So you can screen somebody for what we call non-Magi ABD, Medi-Cal, the 250% working disabled, and even share of cost, SOC. Okay, so I have visuals here in the next couple of slides to kind of help you visualize. I'm a visual person more than like a text person, so I hope this is going to help y'all to kind of understand how spousal impoverishment works. Think of these as income buckets, okay? We're looking at, for example, a couple, and these graphics are courtesy of Legal Aid Society of San Mateo. A wonderful advocate and attorney came and created these visuals, and so I just cut and pasted and using these visuals here. Okay, so keep in mind, let's look at this spouse, okay? Or let's look at this couple. This couple has this amount of income, okay? So spouse A has the blue amount of income, spouse B has the orange amount of income. This line is the line where it's the income limit for free Medi-Cal for one person. So without spousal impoverishment, this couple would have a share of cost. This couple will have a share of cost because their income combined is more than this amount right here. So without spousal impoverishment, this couple will have a share of cost. That's going to be probably pretty high. It's going to be at least in the 2000 or the 1000s to 2000s. The beauty of spousal impoverishment is you are able to split the households, right? So step one is splitting the households from spouse 1 and spouse 2, or spouse A to spouse B. So spouse A has this amount of income in their name. Spouse B has this amount of income in their name. So in this scenario, spousal impoverishment would allow for both spouses to get free Medi-Cal. So no share of cost, free Medi-Cal, because they are both below the income limit for free Medi-Cal. So that's one example of the beauty and the amazing aspects of spousal impoverishment is once you split the households into two, this scenario allows for both spouses to get free Medi-Cal versus regular non-spousal impoverishment case, both the spouses would have a high share of cost. Okay, any questions about this visual bucket graph thing? I don't know what to call it. Okay, I'm going to move on to another example of an income bucket here. So this is a scenario for a couple who has a bit more income. So let's look at these. Without spousal impoverishment, this couple would have a pretty high share of cost. Okay, so it looks like even if we split the household, spouse A still is over the income limit for free Medi-Cal. But the beauty of spousal impoverishment is not only do you get to split the household between spouses, but you also get to allocate. So this money that the spouse A had, they can allocate it over to the what they call the well spouse. I'll say well and I'll call sick. So this would allow for the sick spouse to get free Medi-Cal versus, you know, the both spouses would have a high share of cost. So again, the beauty of it is it allows for a lot of couples to be able to get access to free Medi-Cal or even a lower share of cost Medi-Cal, so they can access Medi-Cal services and other home and community-based services without such a high share of cost.
Joan?
Yes.
We have a question here from Janelle. She's asking, where is the number of income? I don't see it on the screen. I think maybe clarify what the income limit or
is. Can you guys
yeah.
see this amount, the 1801 that I've?
Yeah. Do you
Okay.
see that, Janelle? I don't know if I'm answering.
So 1801 is the income limit for free Medi-Cal for one person. So in this scenario, you know, they would, you know, even sick spouse would be over, but if they allocate some of that blue income over to their well spouse, it allows for them to still remain eligible for free Medi-Cal. This is the MIMNA, basically, oh, that's not right. It's a 3. My apologies. This is supposed to be a 3, not a 2. 3948. This is the limit as to how much can be allocated unless you get like a special hearing order or a court order. But it's below this amount, so we're okay. I hope that answered the question. Any other questions?
Hi,
No
Joan.
questions I see so far.
Thanks, sir. Go ahead, Fernando.
Yeah, I'm curious. I don't know what the political comment is gonna be within, like, if they're gonna increase the asset limit or the income, but what do you see within, like in the future if they're gonna increase it? Just because I'm a little fearful, like with that amount, it's pretty low, so I feel like it's a catch-22 to like be able to make a good income, but then you gotta fit a certain amount to get these benefits. So I'm curious if there's going to be any changes to that.
So these amounts right here, the 1801, and this is a 3. I apologize. 3948. That's a 3, not a 2. These amounts go up a couple of bucks every year.
Okay.
It takes into account COLA and standard of living. So these go up a couple of bucks every year. But if you're talking about asset limits, we're talking about this chart here. The asset limit is coming back, so we're, again, for regular Medi-Cal without spousal impoverishment, you're capped at 195K for a married couple, versus with spousal impoverishment, you could potentially have up to 287K. So the political climate, these changes, the asset limit coming back is in response to the budget cuts. This was because of the state. This wasn't the feds, so you necessarily can't blame the feds for this, but indirectly, potentially you can. But this was pursuant to the state budget cuts.
I see.
Yeah, it's a state budget. I mean, I have a whole other presentation that I just did today with another group about the budget cuts, and I'm happy to come back to Caregiver Resource Center to do like a Medi-Cal budget cut presentation. But the asset test is coming back because the state didn't have enough money to fund no assets. Yeah. So yeah, a lot of these changes are happening in real time. Again, the asset test is going to come back in about 5 months. I hope that answers your question, Fernando. And if it doesn't, let me know.
Yeah, I'm just trying to be like more hopeful for like, when I get to that age, I want to make sure like what's the amount I need to make, but it feels like you got to make a little bit to like get what you need. So it's confusing.
Yeah, so I mean there is a cap even with spousal impoverishment. So you can't have like an unlimited amount of income and an unlimited amount of assets. It just allows for there's that pocket between. It's the pocket between this amount and this amount, and this amount and this amount. So spousal impoverishment is going to come in handy for those who are in between these amounts. But if you're over, you may not benefit. Yeah.
Thank you, though. Appreciate you.
Okay, of course. All right, great questions, everyone.
Joe,
All right, so yeah, go
just
ahead.
really quick. Someone asked if they have an adult children, if their income will count. So it should be no, but you wanna.
So if you are caring for an adult disabled child, that income should not be counted against you. Their income should not be counted against you. And if anything, you might be able to get what they call like a family allocation. It gets really complicated and lots of math involved. Give us a call because we can assess if you're interested in applying for Medi-Cal spousal impoverishment, and you do have an adult disabled child. Give us a call because we're going to ask you about how much they have, and yeah, include that in some of the calculation.
And also regarding someone asked about caregiver spouse, there's also rules on that. So give us a call about that.
Caregiver spouse. Okay. Yeah. Oh, for like IHSS. Yeah. More individualized cases, this is what we do. We ask you, unfortunately, when you go through the intake process through our office, we're going to ask you a ton of questions, but each of those questions we need to be able to get you the correct advice. So we're going to ask you about your income, your spouse's income, your assets, your spouse's assets, all that jazz, just so that we make sure we're giving you correct legal advice. Okay. All right. Moving on, the income scenarios. How can spousal impoverishment help a married couple or registered domestic partner couple? For example, if the county assigns both spouses or registered domestic partners with a high share of cost amount, potentially these scenarios, because it depends on how high your income is, it could reduce your share of cost amount. So at a bare minimum, you might still have a share of cost, but at least it's lower than what you normally would have under non-spousal impoverishment rules. Scenario number 2 is the sixth spouse gets free Medi-Cal, so no share of cost. So it gets rid of the share of cost that you previously had for the sixth spouse. Or scenario 3, both spouses get free Medi-Cal. There's lots of couples who have, contacted our office because of their incomes and where they lie. they both were able to get rid of their share of cost, not only for the sick spouse, but also for the well spouse, the healthy spouse. Okay, I'm gonna skip this. We have well, let's take a breathing break here. Okay, let's do 2 deep breaths. We're an hour into the presentation and we're kind of coming closer to the end, but I just want to make sure we take some deep breaths because it's been a long day, I'm sure, for all y'all. Caregiving ain't easy. And so I appreciate y'all are coming, but making sure you take care of yourself so you can take care of others. Let's do maybe 2 deep breaths. 1 through your nose. Out your mouth. 1. Through your nose. 2. Out your mouth. Okay. I have an income calculation example. It's a lot of math, so I think I'm going to skip it. Just suffice it to say this. And these numbers were based on the 2023 figures, not 2025 figures. This is a lot of math. The baseline, the summary of it is, this is a good case example of how important it is that we properly screen for spousal impoverishment. And also there's something called the assisted living waiver board and care deduction. I'm not going to go into detail about that, but suffice it to say, if the county messes up, they might miss out on both spouses being eligible for free Medi-Cal. So if you ever are concerned about whether or not your spouse would be eligible for spousal impoverishment, and the county, you're getting kind of some resistance from the county about spousal impoverishment, give our office a call. Hopefully be able to kind of provide you an assessment as to whether or not you're eligible. But just keep in mind, there can be scenarios where there's a high share of cost for both spouses, and then a scenario where, you know, one spouse can be eligible for free Medi-Cal while the other spouse has a lower share of cost. And then another scenario where both spouses can be eligible for free Medi-Cal. So the beauty of spousal impoverishment and some of these income deductions can come into play. Okay, all right, so what the heck is what we call long-term services and supports, and what the heck is, I've been using this acronym all day, home and community-based services. Let's talk about what these programs look like. All right, I'm a visual person. If an umbrella analogy is helpful for you, this is what we call the long-term support and services umbrella. It's kind of divided into 2 categories. We're looking at ESI, expanded spousal impoverishment, and then SI. SI is just regular spousal impoverishment. Regular spousal impoverishment, again, talks about those, a spouse who is in a nursing home, who is, quote, institutionalized. So this is those who are in a spouse with a nursing home, a spouse in a nursing home. Expanded spousal impoverishment, ESI, is for those spouses who are in the home or community, and they're getting home and community-based services. So, oh, this is supposed to be services. There's a lot of letters here, but we're going to break down each of these different programs. There are programs, there's waiver programs where you can get the service inside your home. There's also other programs where you get it in the community. And let's kind of break down each of these categories and each of these waiver programs. Again, if this is instead of the umbrella analogy, a tree analogy, if this is helpful for you, again, long-term support and services includes home and community-based services. It also includes nursing home, or what we call, what Medi-Cal still calls long-term care. Again, it's a term of art. But Medi-Cal still calls this institutionalized care or long-term care. These are the programs that offer it in the home. These are the programs that offer it within the community. Okay, so let's talk about these waiver programs and what is offered here in this beautiful state of California, because a lot of these programs, a lot of them are being offered here, specifically in California and specifically in Orange County. Some of these programs don't exist in all counties in the state. These are, well, let's do this. I'm gonna go through this one. Okay. If y'all have attended a prior presentation from me, one of the presentations I did a topic on the long-term support and services. And this cheat sheet was in that same set of slides from my prior topic. This is the cheat sheet. This kind of gives you a summary of each of these programs and what they provide. So these are the programs that are in the home that you receive in the home. There's the HCBA waiver program. It stands for Home and Community-Based Alternative Waiver Program. You basically, through this program, can get private duty nursing, and you also get what we call waiver personal care services, WPCS hours. So this is on top of your IHSS hours that you already have. Potentially through this waiver, you could potentially get 24-hour care, 24 hours a day care. With IHSS, there isn't 24-hour a day care, but with the HCBA program, depending on your medical needs, you potentially can get a max of 24 hours a day care. CFCO, again, it's one of 4 IHSS programs. The max that you can get with this IHSS program, CFCO, is 283 hours per month. There's a CCT program, that's a California Community Transition Project. This requires that you are currently in a nursing home or in a hospital and you've been there for at least a 60-day period. But if it's medically safe for you to return home, it's a program that allows you to get the things in your house that you're going to need to maintain and safely return home. So things like a home and vehicle adaptation. It includes, wheelchairs, hospital beds, and nursing visits in the home. There's also the assist. So these are the following are services that you receive in the community. So these are still considered community. And this also includes the assisted living waiver. So this is where the state actually pays for your care at an assisted living or at a board-in care. So these are different from a nursing home. A nursing home, my prior topic, we went really into detail the difference between a nursing home and an assisted living, but just suffice it to say, in a nursing home, you're getting medical care. At assisted livings and boarding cares, you're getting non-medical care. You're not getting a nurse to help you. You might have a caregiver, but they are not nurses. They are not doctors. But assisted living waiver allows you to have the care paid for by the state, but you still have to pay room and board. So there's still going to be, an out-of-pocket cost for this, but it's definitely cheaper than paying for all of it out of pocket. Yeah, that's several thousands of dollars per month that you'd be saving if you're eligible for the assisted living waiver. We also have what we call the DD waiver, developmental disability. You have to have a developmental disability. Some of my prior clients have had diagnoses of autism, cerebral palsy, intellectual disability, Down syndrome, learning and language disorders. MSSP, Multi-Purpose Senior Services Program. I like to kind of think of this as case management. Most of the time, the MSSP program will refer you to these other waiver programs and help you apply for those programs too. PACE. PACE, in Orange County, we have 3 PACE centers. To be eligible for PACE waiver services, you have to live within certain zip codes within Orange County. You have to live within a certain zip code of one of the 3 PACE centers in OC. The way that it works is you get all of your medical care through the PACE center and the PACE network of doctors. So that means, though, that you no longer are able to see your old doctors. But the idea of it is it's called PACE all-inclusive care. So you're getting it all in one-stop shop. CBAS, community-based adult services, it's adult health daycare. So if you're still at home, but you want to be able to get some adult health daycare services for a couple of hours at a facility, the PACE, the CBAS program will typically, pick you up in their shuttle and then, you know, take you to the CBAS center, and then, you know, you get dropped back off home. You can combine CBAS with IHSS and some of these other waiver programs, and we'll talk about that in the next slide. Okay, I'm gonna just kind of go through this quickly. Just know that all of these programs, you can only be enrolled in one of them at a time. With CFCO for IHSS, you can have IHSS, you can have HCBA. With this, you can also have IHSS with CBAS, which CBAS is the adult health daycare. So you could be at home getting IHSS caregiving hours, and at the same time, you can go to like a CBAS adult health daycare center for a couple of hours during the week, and still get your IHSS. What you can't do, however, is if you're on assisted living, and you're part of the assisted living waiver program, you can't get IHSS. You cannot get both. So you can't do this plus this. And then same with PACE. If you are enrolled into the PACE program, you're not getting IHSS, because PACE is supposed to provide you, again, all inclusive, all the care that you need, the one-stop shop. I think this is essentially the same thing. And PACE, you can't combine it with any other programs because PACE is just a standalone, you know, all or nothing sort of situation. Okay, before I go into that, any questions about these programs? I did, you know, I have a separate presentation on kind of breaking down each of these programs in more detail, but this is just kind of a summary, a one sheet, cheat sheet, I call it. But any questions about these various home and community-based service programs in California?
So I'm a little confused. Does that mean that only one of the people of the couple will get all the services and the other not, or both of them will get
Yeah,
either or?
so we're talking about spousal impoverishment. The spousal impoverishment scenario is where only one of the spouses, the quote sick spouse, is receiving these services. There is a scenario where if both spouses need these home and community-based services, they could potentially get it, but that's a different income and asset calculation. It's called institutionalized deeming. And so it's a different thing. But there is a scenario where potentially both spouses can get these services, but it's different from spousal impoverishment.
Yeah, because what I've noticed is that usually one of the couple partners is, you know, in a living assistant, and the other one is ADA and needs a lot of attention.
Yeah. It's happening more and more often, and even like the quote healthy spouse is no longer healthy, or their condition got worse, and so circumstances might change where even the quote healthy spouse might need services as well. Again, there is a scenario where potentially both spouses can get the services, but it's a different calculation than spousal impoverishment. It's called institutionalized deeming, and it's super complicated. But if y'all have couples who both need care, give us a call and we could kind of run those numbers and run those assessments.
Okay, thank you.
Okay, thanks, Malia. That's a really great question. Thank you. All right. Any other questions about the home and community-based waiver services programs that are offered in California? Okay. I don't think we have too many more slides. We have to worry about Medi-Cal state recovery for some of these programs. So that's why I want to make sure I'm talking about it. Medi-Cal estate recovery, what the heck is that? Basically, do you have to worry about Medi-Cal going after your assets and your estate after you pass away? That's the question that we want to answer. For some of these programs, unfortunately, yes, you do have to worry about it. And for some of these other programs, you don't. So the ones that say yes, the AIDS Medi-Cal waiver program, the assisted living waiver, the HCBA waiver, the DD waiver, MSSP, self-determination. That's yeah, I should include that still. It's a program. These you do have to worry about is Medi-Cal estate recovery. For these other programs, they don't count against you for Medi-Cal estate recovery, so the state can't go after your assets after you pass. But even if there's a yes, if you're enrolled in one of these programs, you can do estate planning to potentially make sure that your assets are safe from Medi-Cal estate recovery. So if you have questions about that, you can give us a call. We are not estate planning attorneys. We could at least give you some initial legal advice, but if it requires some estate planning, like creating a trust or making sure that, your property is being properly handled, we can refer you over to private estate planning attorneys to assist. Okay. Any questions about Medi-Cal estate recovery? Okay. We can go back if y'all need. When does spousal impoverishment apply and when does it not? Let's talk about it. Spousal impoverishment technically applies to undocumented spouses who are already on Medi-Cal. I do have to say, starting January 1 of 2026, and this is pursuant to the state budget cuts, Medi-Cal expansion enrollment is going to be frozen. They call it a lockout. So if you are undocumented and you already have full scope Medi-Cal, there may be a scenario where spousal impoverishment can still apply for you. But if you apply for Medi-Cal after January 1 of 2026 and you are undocumented, you're not going to get full scope. You're going to get what we call emergency or restricted Medi-Cal. But theoretically, undocumented spouses can have spousal impoverishment apply. Spousal impoverishment does not apply to Medicare savings programs. So that's the QMB program, the SlimB, the QY program. Again, if you don't know what that means, you're not required to, but if y'all are familiar with these programs, just know spousal impoverishment cannot apply for MSPs. And spousal impoverishment does not apply to Magi Medi-Cal programs. So this is only for non-Magi. We're talking about the aged, the blind, the disabled, those who have Medicare, those who are subject to an asset test. So not for Magi, not for MSP. Okay. How do I spot someone who may need spousal impoverishment? This is something that we've come across with our own clients, and I built this list every time we have a new client that may fall within some of these categories. But again, you have to be married in a registered domestic partnership, and the couple has a pretty high unaffordable share of costs for Medi-Cal. Typically, when one of the spouses really needs Medi-Cal or really needs IHSS, that's kind of typical of our client profile for spousal impoverishment. One of the spouses needs significant amount of home and community-based services, or they're in need of nursing home care because their medical needs are quite high. So this can include those who are needing help at home, like their day-to-day, they really do need a lot of caregiving, perhaps a decline in health, perhaps recently becoming disabled, or an existing disability that's worsened. We've seen this scenario as well. And this is not an exhaustive list, but this is literally from my past spousal impoverishment clients. I've had spousal impoverishment clients with dementia, with Alzheimer's, with stage 4 cancer, with Parkinson's, ALS, post-stroke. Again, just because you have these doesn't mean you're eligible for spousal impoverishment, but these are kind of some typical diagnoses our past clients have had. When you have a spouse that says, hey, I don't know if I could continue taking care of my spouse, either because of their limitations or because their spouse's needs have become higher and too much for them to be able to handle. We typically get these calls from the spouse saying, hey, you know, it's becoming too much for me to handle because there's just too much care that's need to be done, or, you know, because of my own health that's declining where I'm not able to care for my spouse anymore. If you're currently in a nursing home and interested in returning home, or in a scenario where you've been discharged from a nursing home and you're still struggling, these are the types of, you know, situations where spousal impoverishment may come in handy. Or wanting to stay at home and avoid a nursing home. So, you know, a lot of our clients are in that scenario or that boat. Okay, any questions about this slide? This is kind of like what you're going to be looking for if, you know, if some of these or one of these apply to you, you may want to consider spousal impoverishment Medi-Cal. Any questions? Oh, okay.
I have a question.
Oh, yes, please.
On the last page, you said something about aged, your magi. And my husband is 68 years old, so
Huh.
ESI does not, he's not gonna be eligible to get that, correct?
No, he would be. He would be subject to non-magi. So
None.
yes, so yes, spousal impoverishment potentially can apply. But we have, again, we have to look at your income and your assets and all that stuff to see if you would be eligible.
Thank you.
Of course. Okay, I think this is my last slide. Okay, I was able to finish earlier than I thought, but I want to make sure I leave questions, time for questions. This is how you can reach us. We typically have we have a phone intake. If you press 3, you get to health, you get connected to Vanessa, our lovely intake paralegal. We're open from 9 to 5, but off hours, we do have an online intake available on our website. We're a nonprofit law office. We don't charge for our services. So yeah, our services are free. Let me see. Okay. I'm gonna leave this on for a little bit. Yeah, go ahead.
I think we have people who are not from our county, so probably want to clarify we only serve Orange County.
Yes, if you are calling from another county, yeah, I'm always surprised as to the reach of these presentations. Caregiver Resource Center, I always assumed it's just OC folks, but yes, our services are limited to Orange County residents. However, if you do call us, we could at least give you a referral over to a legal aid that may serve your county. But yes, if you want direct assistance from our office, you have to be an OC resident. Okay. All right, I'm going to highlight, we have specific Know Your Rights presentation topics. Today we did the spousal impoverishment. I know in the past we've done long-term support and services. I think I'm coming back to do additional presentations on different topics. But if there's any of these topics that kind of stand out to you, feel free to let me know, and you could put it in the chat, or you could just raise your hand. And then maybe we can come back to do those presentations for Caregiver Resource Center. Okay. While you're all looking at the topic list, any comments, questions, concerns? I know I threw a lot of info at y'all, but I'm happy to answer anything I can.
Can you hear me?
Yes, go ahead, Belinda.
From Louisiana, and I have a brother that lives in Orange County.
Okay.
Are you able to hear me?
Yes, I can hear you.
He needs to be in a nursing home, and
Okay.
but his share of cost is too much for. I think he meets all the requirements. So what? I'm trying to help the family do this. The wife is not able to do a lot of this stuff on her own.
Yeah. Again, for our intake purposes, you can call us, but we wouldn't either need, you know, some sort of legal document to say that you can speak on behalf of your brother. That might be a power of attorney or advanced healthcare directive. If not, we would have to speak with somebody who has that legal authority or directly with your brother. Yes.
I do have power of attorney.
Oh, okay. Yeah. If that's the case, then go ahead and give us a call. And we can do the, you know, individualized screening for your brother if he's eligible for spousal impoverishment. But he's currently at a nursing home, or he needs nursing home care?
He's in the hospital right now, but
Oh.
we're waiting for, they wanted to place him, but the family said they, his wife, they can't afford it, what the share of cost would be, and he's out of what do you call it? He's out of skilled nursing days.
Oh, I
Cause
see, I see, the 100 days. Okay.
Yeah, he's out of
Again,
those
it's
days.
very income and asset specific, so I can't say, yes, Belinda, your brother's definitely eligible. You're gonna have to give us a call and so we can get all the details. But yeah, feel free to give us a call and we can screen.
Okay, thank you so much.
Cool, wonderful. Any other comments, questions, concerns?
Joan, we have a we have a comment saying this was very well organized and very helpful. Thank.
Yay. Oh, I'm glad. That's my goal, because this is not easy stuff. It took us attorneys and paralegals several years to really understand, and sometimes we still get confused. So we try our best to make sure we explain it in an easy to understand way, but some of this stuff is just really hard to digest. So thank you for that comment. I appreciate it. Again, I don't mind awkward silences. If I tend to be someone who
Sorry,
takes a long time asking questions. So go ahead.
I think I see another question, but I'm having my screen froze.
Oh, okay. Here, let me.
But I think I don't think you live here. If you're not from Orange County, yeah, reach out to if you're from Bay Area, let me see. Sorry, my screen froze, but if you're from Bay Area, please contact Bay Area Legal Aid. Each county should have a legal aid program with a health unit like us to assist with these kind of issues.
Yeah, let me take a look. Okay, I'm not sharing my screen anymore. Sonoma County. You know what? I'm gonna give the HCA number just in case. Okay. How do I get to it? Hold on, y'all. If y'all are coming from different counties, Health Consumer Alliance. Again, I bragged about it. We are part of the Health Consumer Alliance. It's a statewide collaborative of other legal aids in other counties. So this is the contact information, but let me put the telephone number. That's the website. Here's the number. If you're in another county, it's an 888 number. You can enter your zip code and then it'll connect you to a legal aid that serves your zip code. So if you are outside of Orange County, you can use that 888 number. If not, if you are an Orange County resident, give us a call. Again, let me put up that number. Sorry, I have to find my screen. Hold on. Yep, this is our number for Orange County. Okay. I didn't realize there's so many folks outside of Orange County. I'm learning with these Caregiver Resource Center, y'all have a far reach. It's awesome. Okay, any other questions, comments, concerns?
I have something to mention. I'm Lucy Miranda. I enjoyed your presentation. I learned a lot. I've already looked into this, and they were trying other ways. but it didn't sound like we qualified. As they would say, we make too much. But it's nice to know all this in the event that, I need it sometime down the line. Maybe, I don't know. So,
Is this a county that said that you're not eligible because you quote make too much?
I think it was, I guess it would be considered that because that's Medi-Cal.
Yeah, the Medi-Cal County office. Yeah.
Yep.
I mean, suffice it to say, because spousal impoverishment is super complex and complicated, sometimes the county gets it wrong. And so it doesn't always hurt to, give us a call, and we can make sure that we might just tell you the same thing. But at least you could be able to definitively say, okay, yes or no.
Okay. But yeah, and it's interesting because my husband's I'm his caregiver. So even though I'll always ask him now, how much do we make a year, or how much, but then you start counting your assets.
Yeah.
And there it went. I go, oh, I don't care. He goes, well, we could take half of your income, but even after all that, we didn't qualify. But I'm really glad I listened to this because, when it's explained to you once, and guess what? I'm a visual person, so I really appreciate the visual. It's exactly what I need. But then after a while, I said, I think I went through this. I don't think I qualify. But you gave a lot more information than I ever imagined, but it was all informative. So thank you again.
Of course. Yeah, some of our clients are asking about like very specific assets, like, oh, well, does this count? Does this not count? And because the Medi-Cal rules are really specific, we would have to, get that info from you first to be able to say, yes, it's totally going to count, or no, this is definitely not going to count against you. So if you still give us a call, if you're an OC